Well, number one is this is a customized procedure to your goals and needs. In other words, a mommy makeover typically involves a breast surgery, but could be a lift, could be implants, could be both, and an abdominal surgery. Could be a tummy tuck, could be lipo, could be both. It is truly tailor designed to fit your needs, and that's probably the most important thing to know. And you need to express your goals very clearly with your surgeon at the consultation so you both have the same vision. Number two is recovery is very real. Again, especially if we're talking about a tummy tuck, that's one of the more painful procedures we do. Muscle tightening's involved. Plan on at least a week off from work, no heavy lifting for 4 to 6 weeks. Make sure you have assistance at home, especially if you have small children or pets, you're gonna need help with that. So the recovery is quite real, but in the end it's worth it because the procedure is so transformative. Number three is ideally you're done having children. You don't wanna have a tummy tuck or a mommy makeover, have this great outcome, and then a year or two later have another pregnancy, because that pregnancy can sort of undo some of the work that was done. It can create loose skin, it can stretch out your abdominal wall. So in an ideal world, you're finished having your family, and that's the best time to have a mind makeover. Number four is scars are a real part of the process, whether that's talking about breast with a breast lift or the lower transverse incision of the tummy tuck. But I do want to emphasize that all scars are permanent, even though generally they do fade by about a year and they become quite light over time. And number five is, it's not about overdoing it, it's about restoring. You may need a little bit more fullness because the breasts are atrophied. So I hope those 5 tips are helpful. If you have any questions about mommy makeovers, just comment the word Bruno below.